Lives at stake. This is how health officials have described the current water shortage hitting parts of Metro Manila. Low water supplies interrupt the everyday of thousands of residents. But among those most affected by the situation are hospitals, where the lack of water can spell the difference between curing more patients or delaying treatment.
The uninterrupted operations of our hospitals are our priority. We cannot compromise the health of our patients. Lives are at stake.
At the Rizal Medical Center, the effects of little water take shape. Hospital Chief Dr. RELITO says low water levels affect daily activities like delivering babies, performing surgeries, and ensuring basic hygiene and sanitation. From delivering 30 to 40 babies daily, the hospital limits it to 15 to 20. And from completing at least 20 surgeries on a busy day, it now limits this to less than half, with the most urgent cases prioritized.
We're experiencing a very challenging situations, as far as yung effect of this shortage to our patient. So right now, as of this today, we have already 366 inpatients.
Okay.
Just to be 418 yesterday. So I told you, we announced that we will be limiting patients. So the water supply started to be normal yesterday afternoon, but this morning when I was making rounds, nakita namin na kakonti na.
SAQUILAYAN says less water means measures need to be taken to prioritize emergency cases, while delaying treatment for patients whose conditions are less severe. The best the hospital could do is to limit the admission of patients.
When you're leading a hospital like that, our mandate is not to refuse, but with this kind of conditions, it will be very hard for us because we're talking of patient care dito. We don't want to experience yung mga diseases that they will get from the hospital. That will be very not a good image for the DOH.
For new mother Maria Cristina Griego, this means simple but necessary routines aren't easy to complete. When she goes to the bathroom to clean herself, there won't always be running water.
Nahugasan naman po ko nila ng maayos, pero may time lang na walang tubig sa CR, ganun. Ang hirap maghugas, ganun. Pero meron time naman na may pang-flush, ganun.
Mothers are also advised that they may need to bring their own water to clean themselves and their babies.
Kakarating lang po namin dito alas 5, kakalipat lang po namin. Galing po kami delivery room, so hindi pa po siya nakakaligo.
Mothers like Griego say they only have wipes to clean their babies for now, though water would still be best. Meanwhile, the lack of water is not a problem Griego can leave at the hospital when she heads home with her new baby.
May tubig naman po sa bahay kaso mahina. Kaya kailangan po mag-stock sa planggana at drum.
Ayala-led Manila Water assures hospitals will be top priority when supplying water despite the shortage. It also tries to assure consumers water supply will be rotated so areas can have access to water following a specific schedule. Health officials are hoping that the situation does not worsen to a point where hospital operations will be severely limited. With no near end to the dry spell in sight, it remains to be seen how residents and hospitals will cope. One thing is for sure, water remains to be the cure for their woes. SOFIA TOMACRUZ, Rappler, Pasig City.